Good afternoon. I'm John
Perfect.
Clymer, Executive Director of the National Forum for Heart Disease and Stroke Prevention, and we are delighted that you're joining us to learn and share about Move with the Mayor mental health and physical activity initiative. Special thanks to our alumni mayors and cities who are returning, and a warm welcome to those who are new to Move with the Mayor. Today, you're going to learn about how Move with the Mayor works, what to expect, and what you will gain from participating. We're going to hear firsthand from Mayors Rachel Proctor of DeSoto, Texas, and Quentin Hart of Waterloo, Iowa, about their experiences in Move with the Mayor. And at the end of the call, you will have an opportunity to ask questions as well as to share what you're planning in your community. This meeting is being recorded, which will enable you to catch the playback. Move with the Mayor is celebrating a decade of impact. Mayors across the country are using Move with the Mayor to promote physical activity, social connection, mental health, and overall well-being in their communities. The initiative serves as a catalyst for community engagement and public health by motivating residents to participate in physical activities while building social connections. By uniting local governments, organizations, and residents, Move with the Mayor fosters partnership-driven initiatives that contribute to improving community health. It's a powerful vehicle for mayors to lead by example in showing the importance of healthy living while addressing health disparities within the community. We're grateful for our partners, the American Public Health Association, and of course, the Centers for Disease Control and Prevention, the CDC, for supporting the expansion of Move with the Mayor to address mental health, social connectivity, and their relationship to cardiovascular and physical health. And we'd like to thank U.S. Conference of Mayors President and Reno, Nevada Mayor Hillary Sheevy for her leadership in prioritizing mental health and launching the National Mayor's Mental Health Initiative, which incorporates Move with the Mayor. Loneliness is associated with an increased risk of heart disease, stroke, depression, and anxiety. That's why social connectivity is at the heart of this challenge. Now I'll turn it over to Jen Childress, Director of Programs, to share more.
Thanks so much, John. As you mentioned, social connectivity being at the heart of this challenge is very much our driving North Star. Social connectivity is the structure, function, and quality of our relationships. And by encouraging residents to connect, you can make a difference in reducing the risk of health issues related to loneliness. During the challenge, the activities that you organize will bring people together, and the messages and resources that you share can be part of activities that you're already doing to amplify and raise awareness on the connection between mental and physical health. We're delighted to hear personal experiences from Mayors Proctor and Hart, who will share with us examples of how they've implemented Move with the Mayor. And at the end of the call, we invite you to share your ideas and insights. Some of the benefits of participating in the challenge are boosting engagement within the community and among city employees, improving the health of residents, and taking the lead and bringing a national initiative to your community. You can do all of this at no cost with the added bonus of having access to easy-to-use evidence-based assets. Here's a brief overview of the challenge timeline. This month is dedicated to event planning and promotion. May, which is Mental Health Month, is the official challenge period when events will take place and you'll have the opportunity to complete roadmaps. In June and July, we will spotlight success stories and provide tailored feedback on your roadmap results. In a moment, we will share more information on the details of the challenge. So far, 39 cities across the U.S. representing geographic, racial, and political diversity have committed to participate in the Mental Health and Physical Activity Challenge. If you're tuning in for the first time today to learn more, we hope that you'll join as well. It's my pleasure to introduce our spotlight speakers, both of whom are actively engaged in Move with the Mayor and committed to the health and well-being of their community members. Please help me welcome Mayor Rachel Proctor of DeSoto, Texas, and Mayor Quentin Hart of Waterloo, Iowa, to share why they've made health a priority, as well as their experiences in Move with the Mayor. Mayor Proctor.
Thank you, Jen, for this opportunity. It's been such an incredible experience working with Move with the Mayor. I'll say I got started and actually learned more about Move with the Mayor when I met Jen, and we actually sat together at a U.S. Conference of Mayors luncheon, and she was telling me more about the initiative. And so I actually lost my father in 2015 to high blood pressure and a stroke. And so it really resonated with me in terms of the importance of making sure that our residents have access to things that help them to create a healthy lifestyle, because we all know that a healthy community is a thriving community. And so since we've become partners with this initiative, we've been able to actually have 5 official events. So we've had 2 of our fitness challenges at our recreation center. So we partner with our Parks and Recreation Center to do those. And the residents got to come out and see exactly what amenities and what classes that are already available in their community. So they're not having to go outside of their community to get that. We've also had a Move with the Mayor for our senior citizens. So we have a very thriving senior activity center. And so we had Move with the Mayor there, and we had fitness instructors to come there. They had chair volleyball, all sorts of things for them to be able to participate in. And they had a blast with that. We had probably well over 150 seniors that participated in that event. And then one of the most fun events that we've had, I think, and most unique, we had DeSoto on Ice Move with the Mayor. And so we actually had an ice skating rink in our city for the holiday. And so we had probably well over 100 skaters as well to come out, and they were able to skate for free, but they could bring their families out and participate in that event and get moving in the wintertime. So we were excited about that. And so I will say that in terms of not only partnering with National Forum for this initiative, we've had some excellent local partners. So with each of our fitness initiatives, when we have them at our recreation center, we always have different local fitness instructors to come out and conduct educational classes as well as the actual fitness classes themselves. We also have a very strong partnership with Methodist Hospital System. So they actually come out and talk about classes regarding stroke prevention, diabetes prevention, healthy living, nutrition, and all those types of things. We've also had a very good partnership with lots of healthy food vendors. So at our events, you know, if you've been working out, you get hungry. So we actually had several food trucks that provide healthy options for our participants in our program. So that's been really great for us as well. Now, I will say, even with all of the success that we've had with this, we have had a few challenges. And one of the biggest challenges, honestly, is getting people to sign up. Working out isn't necessarily the first thing on a lot of people's mind. And so one of the things that we saw was that people who, you know, asking around when people decided not to sign up, what was one of the things they hesitated on? And so for that, we were able to recognize that people wanted to kind of know more about the classes or wanted to try some different things. So when we did our next Move with the Mayor Fitness Initiative with our recreation center, when they registered for the event, they were able to check off what classes they wanted to attend at that time. So if it was trampoline aerobics or, you know, pickleball or whatever it was, they were able to see exactly what we were offering, what time it started, so it wouldn't be so ambiguous. And so we had a lot more signups that way when people were able to get that information ahead of time. And one of the last things that I'll say is I'll kind of end with a success story that we had with Move with the Mayor. And we had our very first one, I believe it was August of 2022, I think is when we had our very first one. And when we were getting ready to have our next event in the spring, I had a resident reach out to me, and I had no idea that she attended the first one we had. But she said, "I'll be there with bells on." And I said, "Okay, well, that's great." And she continued to share more about her experience. And she said it was that Move with the Mayor event in August of 2022 that helped motivate her to get on her weight loss journey. And since that event, she had lost 60 pounds. And she was, you know, just motivated by the event itself to continue to lose weight and to develop a healthy lifestyle. So that was just an incredible story even if it was just that one person, right, that walked away from the event with the motivation they needed to flip the script and really start their healthy lifestyle, it made it all worth it. So we're grateful to be partners with this initiative.
Fantastic. Thanks so much for sharing your personal experience and stories and feedback in terms of tips and resources. That's fantastic. And what a great accomplishment. I encourage everybody, Mayor Proctor, if you can pop in your social media into the chat, because you do such a fantastic job of sharing your stories and highlighting your events. And it is awesome to see all that going on. So thank you so much.
Thank you.
Now I'll turn it over to Mayor Hart.
Thank you so much, Jen, and thank you for all your efforts and work that you do. And Mayor Proctor, that's incredible examples of health resiliency. So thank you so much. But Mayor Quentin Hart, City of Waterloo, Iowa, and one of the first reasons that I wanted to be a part of, other than Jen is does such an incredible job talking about the program, is that several years ago, there was a report about obesity rates and asthma rates within our local community. And so from just an overall perspective of health and well-being, I think it's important for mayors and for everyone to come together to try to help conquer and challenge some of those rates. And if you take a look at it, health, if there's anything that we can rally around with, rally for, that is just health of our communities. There's not a Republican issue, not a Democratic issue, an independent issue, just working for health helps improve our entire community. And so in the last couple of years, we've been fortunate to start a couple different things that we're doing locally. And one is called the Mayor's Pump and Run event. And the good thing about it, it's a 5K, but that Friday before the Saturday, the 27th, when we actually do this, we actually get to do curls and do some bench pressing, and that actually lowers your time frame on your 5K run. If not, so if you see a very fast time, that means I've been doing a lot of curls and stuff to try to make that happen. But it's one that you go through our Cedar Valley Sportsplex. There's a number of different partners that are available that are helping us work through this as well. Another event that I'm very proud to talk about is the Live Healthy Iowa Kids Track Championship that will be held in May. And it's children throughout the community, throughout the state that are coming here and trying to compete and work hard with regards to track and field. And one of the reasons that this is such a good program, because we know there's a lot of video games, we know there's a lot of social media that we sit behind a television or a phone, but this is an opportunity to actually get kids up and running as well. Another event that happens a little bit later is our Mayor's annual fun run. It's where every fourth grader in the entire state, entire city, run against the mayor for about 1.5 miles throughout our downtown, which is really great. And I'll say last but not least, yes, move with the mayor, and that's good, but also during this same time period, since we've been members, there's really been an emphasis on mental health as well. And our Mayor's Youth Council has been able to tackle some of those issues. On the back of every student ID card, this was just done in the last 2 years, there is a barcode on there where if you scan it with the phone, you'll be able to see different mental health services that are offered through our K through 12. This Mayor's Youth Group has also won a regional Emmy for their PSAs that they've given out to the local community. So from health to mental health, our partnership with Move with the Mayor has really been able to help us realize some of the benefits of health, physical and mental as well. So thank you for all you're doing as well.
That's incredible, Mayor Hart. Thanks so much for sharing that. I love the idea on the back of the cards. That's awesome. So many, many thanks to Mayors Proctor and Hart for sharing more about what you're doing in your communities and for your leadership and commitment. This is exciting. And Mayor Hart, if you don't mind popping your social media handles into the chat so others can follow. You do a great job as well of posting all of the great activities that you're doing and engagement in your community. So this is so exciting. So next up, I'm going to turn it over to our team of community engagement coordinators to share more information on the challenge.
Hi, my name is Shalana, and I'm a community engagement coordinator with the National Forum. We're going to review the resources that will be available to you throughout the challenge. But first, let's jump into the requirements. There are 3 requirements to participate in the Spring Mental Health and Physical Activity Challenge. The first is to host or participate in at least one event during the month of May. We chose May for the challenge because it is Mental Health Awareness Month. Any event that has a physical activity component that is open to the community and provides an opportunity for social connectivity will count towards this requirement. The event can be a standalone event or integrate and enhance existing community activities. The second requirement is to share messages about the importance of social connection, physical activity, and mental health. This can be at your event, on social media, through a press release, or any other method that you have to get information out to your residents. We encourage you to tag the National Forum and use the Move with the Mayor hashtag on social media so that we can amplify your messages. And the last requirement is to complete the roadmap before May 22nd. The Connect, Move, Thrive Roadmap to Active Connected Communities is a self-assessment tool that you can use for planning ways to implement mental health supports and promote social connection in your city. And Emma will cover more details about the roadmap in a few minutes. That's it. Those are the only requirements to participate in the challenge. We strive to make it as easy as possible to participate and move with the mayor. And over the years, we've received feedback that our coordinators make it easy to get started. If you need contact information for a coordinator, we're popping it into the chat. If you don't know who your coordinator is, please let us know right away and we will have someone reach out to you. Up next, we're going to preview the communications toolkit with Amanda.
Thanks, Shalana. Hi, I'm Amanda, and I'm going to go over what's included in the communications toolkit. Social connectivity and physical activity are essential for a healthy mind and body. But in today's digital age, we often find ourselves glued to screens and disconnected from the world around us. That's where effective communication comes into play. We have developed a communications toolkit that features simple social media posts and graphics. We included a variety of posts and graphics to cater to different platforms and audiences. The audiences we tailored messages for include younger adults, older adults, the LGBTQ+ community, and veterans. Each of these populations are at high risk for anxiety, depression, and suicide. One of our main goals with this toolkit is to raise awareness and encourage people to improve their mental and physical health. Our toolkit includes engaging images, informative infographics, and catchy captions that can be easily shared on social media. The toolkit also features a PDF version of a physical activity and social connectivity tracker that you can share with residents to track their activity. Other assets include a fact sheet, a sample employee newsletter, a sample editorial, a sample press release, and a sample proclamation. All of these tools will be available to download on the Move with the Mayor website. The website will feature resources and information about the benefits of physical activity and social connectivity for mental health. It will also feature a calendar of Move with the Mayor events so you can see what other cities are doing to promote healthy communities. We designed the website and the toolkit to help individuals and organizations promote social connectivity and physical activity in their communities. Because when we communicate effectively, we can inspire change and create a positive impact in the world around us. Thank you.
Thanks, Amanda. I'm Emma Waugh, the Program Evaluator for the National Forum. As part of the Spring Challenge, we have developed a self-assessment tool, Connect, Move, Thrive, a roadmap to active, connected communities. This tool was developed based on the 2023 U.S. Surgeon General's report, Our Epidemic of Loneliness and Isolation, For those of you that are familiar with the Move with the Mayor physical activity roadmap from the fall, this one is similar, but condensed and more tailored to focus on programs, policies, and activities that can be implemented in communities to promote social connection. It focuses on foundational areas and key recommendations identified by the Surgeon General to support social connection in communities. These include building a culture of connection, strengthening social infrastructure in local communities, and enacting pro-connection public policies. It also asks you to consider how partners advance social connection in communities. There are roughly 30 questions, and it's around 8 pages in length. It will be distributed as a fillable PDF at the start of the Spring Challenge on May 1st, and we're asking that you complete it by May 22nd. We encourage you to work with members of your public health department, Parks and Rec, school district, or other relevant community partners. We hope that by completing it, you will learn about creative ways to promote social connection. It also includes numerous resources and examples of work going on across the country. Lastly, if you have any questions while you're completing the roadmap, reach out to your community engagement coordinator. Now I'll pass it on to Michelle.
Hi, I'm Michelle, Community Engagement Coordinator. As Amanda mentioned earlier, the Communications Toolkit will soon be available on the Move with the Mayor website. To expedite the process and to ensure that you have the necessary resources to kickstart your involvement in the challenge, we have made the press release and proclamation available immediately following this webinar. By visiting the Move with the Mayor mental health page, you will have instant access to get started. The press release and proclamation are designed to use and adapt as you see fit. We will pop the link in the chat and send an email following the call. We recognize that your time is valuable, and your community engagement coordinator is here to provide you with the tools and support you need. We are committed to facilitating your efforts to enhance your community's physical and mental health, and we are dedicated to ensuring that you have the resources you need. Please don't hesitate to reach out with any questions. Thank you for your dedication and support. We look forward to amplifying each of the Move with the Mayor events you have planned.
We have time for some questions and answers. Mayors Proctor and Mayor Hart, thank you for your presentations. It's really exciting, really inspiring to hear what you're doing in DeSoto and Waterloo. And I know we have a number of mayors who've joined us. In fact, I was thinking, oh, I'll recognize them, but there are too many to call out. So that's exciting. I do want to say, since we recognize Mayor Sheevy, the current president of the U.S. Conference of Mayors, I do want to recognize Mayor Couts, a distinguished past president of U.S. Conference of Mayors. So Mayor Couts, thank you for joining us from Minnesota. Mayors Proctor and Hart, I'll start with you. What are your goals for the Spring Challenge? What are you hoping to accomplish? And I guess most importantly, what are you wanting to change for your communities? Since Mayor Proctor started with the comments, Mayor Hart, why don't you lead off here?
Well, first I want to finish. I'm trying to finish, right? It took me a while last year. So, I'm trying to put myself in the best shape for my local community as well. But just also continue to change the culture around the thoughts about health and about getting out walking or getting out running, but just change the overall culture that we may have with regards to doing that. We both know that, all of us know that, improved physical health is good for a healthy community. It increases the amount of people that connect with one another when you're out and about and you're working with people. And a healthy community is a strong community as well. So just somewhat of the goals that I have.
That's excellent. Mayor Proctor?
Yeah, I would echo those sentiments. I think one of the things that we're really getting more focused and dialed in on is specifically the topic of mental health in our communities and amplifying that conversation. Most recently, our teen council in DeSoto had a mental health forum where they were able to come and have different speakers and have different workshops and sessions on helping our young people who now before they deal with a lot more than I think we had to do when we were coming up and growing up. And they have a lot more things to contend with as far as challenges to mental health. And so one of the things that we're going to continue to do and really continue to amplify is around mental health in terms of that and how it pertains to just every day. And so one of the things that I've challenged myself and my team with is continuing to do the focused events that we have in the spring and the fall, but also seeing how we can break that up into more bite-sized things that are more practical for people from an everyday standpoint. How can we help people incorporate mental wellness and physical wellness into their day-to-day lives? One of the things that I'm going to be working on is having more walking meetings and some walking town halls where we can have our town hall meeting, but we're not going to just sit in the city council chambers. We're going to get out on our trails and we're going to walk and talk that way. So just helping people to figure out what are some practical things and some baby steps that people can take to be able to enhance their physical and mental wellness. And so that's our goal.
That sounds great. And we'll equip you with some I'm in a walking meeting badges. We got that idea from Mayor Kim Norton in Rochester, and it's an idea that Steve Benjamin picked up on as mayor of Columbia and that he's taken into the White House. So we made special White House I'm having a walking meeting badges for him. But it's a great way for you to change norms in the community. And as Jen talked about earlier, to lead by example. I love in both of your comments, or the comments both of you made, how you're talking about personal goals in addition to community goals, because I think that personal commitment and recognition that you're striving as well just adds to your authenticity and the authenticity of this initiative and helps to engage community members. And it's so exciting to hear the examples of real people who have lost 60 pounds or hit some other important milestone in their health journeys. So congratulations to both of you. I know we have some other mayors online. If anybody has a question or wants to very briefly talk about your goal in your community for the Spring Challenge, we have a couple of minutes. I want to say hi to Mayor Skaman in particular, as a former Oak Park resident. Really happy to have you involved in Move with the Mayor. Mayor Proctor, as you've put Move with the Mayor to use in DeSoto, has there been some challenge that you encountered? And if so, how did you surmount that?
Yes, I kind of briefly mentioned when I was speaking earlier, it's getting people excited about health and wellness. A lot of times when individuals have, sometimes working out is not always the fun thing to do, but really creating opportunities and spaces where it's a safe space where nobody feels judged about, whether or not where they are in their fitness journey. And just creating things that are fun and new for people to do that sometimes when you're doing it, you forget you're actually working out. So that was a challenge for us, getting people excited, but also we overcame that by really going back to the drawing board after our first event and really creating some fun spaces where people could come and really fun was at the forefront versus, oh, I'm working out and all these things that a lot of times people don't necessarily want to do when they're thinking of things to do for that day. So.
Thank you. And Mayor Hart, I know that in Iowa, you've made economic development and economic resilience for your community priorities. Certainly health equity or just equity across the board is a priority as well. How do you tie those things together, and how does Move with the Mayor help you do that?
Well, one, the incredible amount of resources and the information that you share across mayors. By bringing this all together, I just listened to Mayor Proctor and just came up with an idea or thought about what I may be able to do here locally. So bringing us all together, sharing best practices is number one. Number two, just the challenge that Mayor Proctor mentioned about just overall engagement. How do you increase those levels with the local community as well? So you're not just doing a pump and run by yourself, right? But how you increase the levels of engagement. And then number three, it's really making us think outside of the box, even with our parks and recs and our parks in different neighborhoods, right? You know, how can we increase opportunity through structuring our parks differently so that we can continue just this conversation about physical health throughout the entire year as well. So this is an incredible jumpstart and helping us to make sure that we have the practices now, but that we continue them 365.
Excellent. Thank you. That's really instructive. And I love how you're picking up ideas right here in real time. And you're sharing ideas with each other. That's to me, one of the exciting things, one of the great dynamics.
Can I just say one thing really quickly? Please. I know we're on a time schedule, but just like the conversation about having walking meetings, we will have a meeting inside this building during the summer to talk about a portion of our recs and trails. Why not just getting out and going over to that portion we're talking about to look at it, use it. You know, we talk about our bike lanes. So we'll sit in the office, we'll talk about the different bike lanes that we're trying to do and never actually get outside to experience it at the same time. So this is changing my mindset on the way that I do things with staff and getting behind this computer and getting out into the streets to do some of these things.
Oh my gosh, that is exciting. Thank you for sharing that. Well, as you suggested, Mayor Hart, our time is up, and we need to draw this to a conclusion to be respectful of everybody's time. My gosh, we've sure learned a lot from both of you, Mayor Proctor, Mayor Hart. Thank you for sharing. Thanks to the National Forum team for sharing so much information. I am really excited to see the results that all of you mayors are able to achieve for and with your communities in the Spring Challenge. And we look forward to helping you publicize what you're doing and draw recognition and share more ideas with one another as the program continues. So thank you for joining this meeting, and thank you all for participating in Move with the Mayor. And with that, we are ready to move on to the next part of our day.